So a few weeks we talked about witching hours. So those were when your baby is a little bit fussy or sometimes a lot fussy for a couple hours a day, usually during the late afternoon, early evening, when their nervous system's just a little dysregulated and they want extra cuddles, some extra feeding, and it passes by the time they're about 3 months old. Today we're going to be talking about colic. So in my opinion, colic is a medical professional's way of saying, I don't know why your baby is so fussy. And from my professional and personal opinion, that's just not good enough. We need to be able to get to the root cause of why a baby is so uncomfortable, because that's not the normal state of what an infant should be like. They should be able to be settled. So what are the essentially symptoms of colic would be excessively fussy, excessively gassy. This gas and fussiness can impact the way that they feed. It can impact the way that they sleep. And essentially, they're just really uncomfortable. And so let's get to the root cause of this. So it could be many things. One, it could be an overactive letdown or an oversupply where the baby's taking in air while feeding. It can also be related to oral ties, so tongue ties, lip ties, which impact the way that the baby moves milk from the front of their mouth to the back of their mouth, and then swallowing. And so it can make it so that way they either fatigue while they're feeding or they're taking in air, again, while they're feeding. Another thing could be a foremilk hindmilk imbalance. So sometimes babies get in a little bit more, too much of that foremilk, which is, lower calorie compared to the higher calorie hindmilk. And so that can cause gassiness, fussiness, because that foremilk kind of ferments in their belly. And then dietary sensitivity. So sometimes there's something in a parent's diet that might be affecting the baby's digestion. Many medical professionals will immediately recommend removing dairy, and that's not always the root cause of the issue. So how can you solve this? Essentially, seek support. So you can adjust your breastfeeding position. So trying laid back breastfeeding to slow your milk flow down, help your baby pace their feeding a little bit easier. But definitely meeting with a lactation consultant to identify potential issues like oversupply, oral ties, and feeding challenges. And then if you think it's a food sensitivity thing, meeting with someone like a functional nutritionist who will help you keep a food journal and look at your diet and your baby's symptoms to see which foods might be triggering fussiness, but also looking at repairing gut health for both you and your baby so this doesn't just keep coming back over and over. So I promise you there are solutions to your baby's colic, and seeking that important support will help you identify those issues hopefully as soon as possible.